Hi guys, welcome back to the channel. We have left video on last Wednesday. I hope we have completed Impaction. As promised, I am back on Monday with new topic, that is maxillary sinus. Let's start. Maxillary sinus. We will see development and anatomy. Firstly is development of maxillary sinus. First of the paranasal sinus to develop. It is the first of the paranasal of all paranasal sinus. This is first sinus to develop. Okay, developing start as a shallow groove or outpouching on the medial surface of maxilla during the 4th month of intrauterine life. Okay, start as a shallow groove or outpouching on the medial surface during the 4th month. Okay, now expansion occurs more rapidly until all the permanent teeth has erupted by a process called pneumatization. It is believed or said that the expansion stops after all the permanent teeth has erupted. Okay, and it grows by the process called pneumatization. However, occasionally the sinus is pneumatized further after removal of one or more maxillary posterior teeth and extend into the residual alveolar process. This is occasionally, not an usual process. In adult, the apices of the posterior teeth may extend into sinus cavity. It may extend into sinus cavity. ठीक है, it reaches to maximum size around 18 years of age. Maximum size आ जाता है 18 years क्योंकि it is believed that till all the permanent teeth except the wisdom tooth molars, all the permanent teeth are erupted. In its development, maxillary sinus is tubular at birth, ovoid in childhood and pyramidal in adulthood. Okay, I have given a very brief embryological, we can say, embryological development of maxillary sinus, and I'll tell you about the volume and size also in embryology thing only. Then we'll go to anatomy of maxillary sinus. Now size changes. During birth, it is tubular at birth. We have seen it is 2 centimeter into 1 centimeter into 1 centimeter. Okay, in between 0 to 9 years, it is ovoid appearance. Okay, in 0 to 3 years, it is 7 mm into 4 mm into 4 mm. Volume is 6 to 8 milliliter, and at the 3rd year, half of the adult size it attained. During 3 to 4th year, it increases in width with the facial growth. With the facial growth, it increases in width. Okay, plus minus 9 years, it attained a size of 27 mm into 18 mm into 17 mm. Okay, it is all in mm. Now volume is 10 to 12 milliliter. 60% of the adult size attained in 9 years, up to 9 years. Then 9 to 12 years, antral floor parallel to the nasal floor. Okay, it come parallel to the nasal floor. Now in 12 to 18 years, it attained. This is the actual, now we can say, dimension of maxillary sinus in adults. Okay, the height is 3.5 centimeter, depth is 3.2 centimeter, and width is 2.5 centimeter, and volume is around 15 to 30 milliliter. Okay, these are in centimeters. So remember, this is the adult dimension of maxillary sinus. So this was the brief intro about this. Now coming to arterial venous nerve supply of maxillary sinus. Arterial blood supply is through greater palatine artery, infraorbital artery, facial artery and maxillary artery. Okay, greater palatine, infraorbital, facial artery and maxillary artery. Venous blood supply is through pterygoid venous plexus, palatine vein and facial vein. Now infraorbital artery and posterior superior artery anastomose to form anterior alveolar artery. Again, infraorbital artery and posterior superior artery anastomose to form anterior alveolar artery. Okay. Now lymphatics is through infraorbital foramen and ostium. Ostium is an opening in maxillary sinus. Okay, then to submandibular and deep cervical lymph nodes. Okay, this is the lymphatic drainage. Now nerve supply is through maxillary division of trigeminal nerve, the posterior superior artery, the middle superior artery and the anterior superior artery, and infraorbital nerve or anterior or greater palatine nerve. Okay, the nerve supply and the Arterial supply is mainly through maxillary artery and nerve. Okay, now coming to anatomy. Antrum or cave of hive mode is called maxillary sinus scope. It is paired and pyramidal in shape because in adulthood it acquires a pyramidal shape with an apex, base, roof and floor. Now base. The base is formed by the lateral wall of nose and the apex is towards the zygomatic process. We can see in this. See, this is the apex. Okay, this is the schematic diagram. This is orbit, nose. There would be meatus, inferior, medial and superior meatus, and this is the maxillary sinus. So apex is towards the zygomatic process. This is apex. It is towards the zygo. यहाँ पे zygomatic process होगा. यहाँ पे cheek आएगा अपना. तो यहाँ पे zygomatic process. तो apex is towards the zygomatic process. Okay. Now base is the lateral wall of nose, ठीक है, and roof is orbital floor and medial wall separates the sinus from nasal cavity, ठीक है. Base is lateral wall of nose and roof is orbital floor. Okay, this is the base. So this is the lateral wall of nose, so this is the base. This is the roof, which is the orbital floor of orbital floor. Or this is orbit, this is orbital floor and this is roof. So this is apex, which is towards the zygomatic process. This is base, which is the lateral wall of nose. This is roof, which is the orbital floor. And there is a floor of maxillary sinus, which is towards the, we can say, there is the alveolar process of maxilla or a palatine process. Mainly the alveolar process. Root apices come here. Premolar, molar, root apices. So this is the alveolar process. So this is the floor of maxillary sinus. Okay. This is the floor of maxillary sinus. Then there are two things. Anterolateral wall and posterolateral wall. So anterolateral, we can imagine that this is a 3D structure, not a 2D structure. What I have shown is a 2D structure. So we have talked about apex, base, roof and floor. Now coming to the walls, the anterolateral and the posterolateral. So anterolateral wall extends from the pyriform aperture anteriorly to the zygomatic suture and infraorbital rim superiorly, like this. Okay, and posterolateral wall, zygoma and greater wing of sphenoid, like this. This will be the anterior wall, this will be the posterior wall. There will be the apex, there will be the base. Okay, I hope I am clear with the wall, apex, walls and floor and roof, apex and base of the maxillary sinus. Okay, open in the narrow ethmoid infundibulum and it is known as ostium and open. Here, see, here will be the opening. यहाँ पे meatus होंगे सारे and here will be the maxillary sinus opening in the ethmoid infundibulum. Okay, this will be known as ostium. This will be known as ostium. Here will be the opening. Okay, it is lined by pseudo-stratified ciliated columnar epithelium. Pseudo-stratified ciliated columnar epithelium. Okay, which is also known as Cnidarian membrane. So that's all for embryology and anatomy. We will see applied anatomy and classification of diseases of maxillary sinus in the next class. Till then, like, subscribe and comment. Bye. Take care.